Hello, everyone, and welcome back to another video brought to you by SeniorCatWellness.com. Today, we'll be discussing the very sensitive topic of feline infectious peritonitis, also known as FIP. Before we begin, I'd just like to, in full disclosure, set some borders for this video. This material deals with a viral disease that is often fatal. So, as it relates to potential treatments, life expectancy, etc., none of that will be covered in this material. Not that it can't be covered, but Senior Cat Wellness will not cover it in this video out of respect. Why? We are refraining because it is not our position to give false hopes, assign a lifespan number, come off as a messenger of bad news, etc. Just like humans, every cat is different, and not every cat with FIP will exhibit the same issues, have the same struggles, etc. No cat is a statistic. So, out of respect, we will refrain from that aspect of things. Having said that, if you would like to know about potential therapies, medications, treatment plans, etc., we encourage you to get in touch with a trained professional. Contact your vet if you'd like to know more about FIP, especially as it relates to life after diagnosis. With that said, we'll now get down to business as it relates to the core information regarding this viral disease. Feline infectious peritonitis is a byproduct of feline coronavirus. Now, before we press on, it must be stated that feline coronavirus and SARS-CoV-2, more commonly known as COVID-19, are not the same viruses, and feline coronavirus does not impact humans. Due to the timing of this video, given the current state of life in our society, it must be made clear that feline coronavirus and COVID-19 are not the same. FIP originates from what is known as feline enteric coronavirus, or FECV. Most cats infected with feline enteric are symptom-free during the early stages or only experience marginal bouts of diarrhea and or respiratory distress. Within roughly 1 week to 10 days after contracting FECV, cats will develop an immune response to the condition via antibodies and will slowly recover. However, an estimated 10% of cats that are infected with FECV will develop what is known as feline infectious peritonitis. This is the result of one or more viral mutations forming and changing its biological composition. In layman's terms, FECV essentially transforms into something that it's not, thus becoming a virus that is far more serious, more progressive, and extremely grave without therapy treatments. FIP is born when white blood cells become infected, thereby spreading the coronavirus throughout the entire body of the feline. Once this occurs, the condition officially becomes known as Feline Infectious Peritonitis Virus, or FIPV. As the body reacts to the virus, vessels that are located in and around the tissues where the virus is housed become compromised. The abdominal area, the brain, and the kidneys often fall victim to an inflammatory reaction caused by the virus. When it comes to the risk factors, or more specifically the age risks, FIP is typically found in younger cats and kittens. Roughly 70% of all cases of FIP are diagnosed in felines that are less than 2 years old, and almost 50% of those cases are found in cats less than 7 to 8 months old. In terms of transmission, a cat that carries FECV can transmit the disease to other felines. It often occurs when the mother passes it on to her young. However, cats that are housed in shelters, catteries, or even if you have a bunch of cats at your home in very close quarters, are more likely to get FIP from an infected FECV carrier. As we mentioned earlier, only an estimated 10% of all cats with FECV will develop FIP. Male cats and felines that are of a senior age, typically 10 years and older, are more susceptible to develop FIP. Although the core reasons for this remain unknown, one could speculate that the latter is due to the declining overall immune health, but here again, it is just pure speculation. As we mentioned a bit earlier, cats that contract FECV are often asymptomatic for a while. In many cases, an upper respiratory infection accompanied by watery eyes, sneezing, and nasal discharge are the core symptoms. Other cats can exhibit stomach ailments that can manifest in diarrhea. However, felines that have FECV typically fall ill for only a short period of time before they naturally improve. With respect to cats that later develop FIP, there could be a lengthy waiting period for symptoms to develop. It can even take years after initial exposure. Yes, years. There are two major types of FIP: effusive, also known as wet, and non-effusive, which is known as dry. No matter the type, early symptoms are often generic and can be mistaken for numerous other ailments: loss of appetite, depression, weight loss, mild fever, etc. Nothing glaring per se. However, as time progresses, more symptoms can develop at a more rapid rate. If effusive is at hand, nonspecific symptoms, in addition to the accumulation of fluid within the body, can manifest. The abdomen and chest cavity can appear swollen due to fluid buildup. Cats can also develop a fat bellied appearance. It must also be noted that both types, wet and dry, can manifest into the other type over time. What begins as effusive can develop into non effusive and vice versa. Before we conclude this video, we'd just like to express our best wishes to every cat owner who is currently caring for a precious feline that is in the midst of FIP. As you know, this viral disease is extremely critical, and the consequences can be dire. Just remember that your pet is not some stat on a piece of paper. Never give up. Always seek out the best therapies available and just take things one day at a time. Always maintain hope and a positive outlook. Life, well, it's all about enjoying the journey. So make each and every day count for your cat and for yourself. If you found this content helpful and informative, please like, share, and subscribe. Has your cat been diagnosed with FIP? Would you like to share your story of hope? If so, we invite you to do so in the comments section below. There is strength in numbers, and if others can benefit from your story, then we'll all be better for it. For all things feline, please be sure to visit us at seniorcatwellness.com. We are your one-stop shop on the internet for your questions, concerns, and general care needs. And until our paths cross again, and I certainly hope they do, we'd like to thank you once again for joining us today. Please have a wonderful day. All the best to you and yours, and we will talk to you later.